Unit 1 of Child Health Nursing with new topic Role of Nurse in Child Health Care. So, role of nurse is as a primary caregiver, health educator, nurse counselor, manager, child care advocate, researcher, recreationalist, nurse consultant, team coordinator and collaborator, social worker. Now we will see these roles of nurse one by one in detail. So first role is as a primary caregiver. Pediatric nurse should provide preventive, promotive, curative, and rehabilitative care in all levels of health service. So, as a nurse, as a pediatric nurse, the nurse should provide preventive, promotive, curative, and rehabilitative care in all levels of health services. On all levels of health service means whether in PHC, CHC, USC, district hospital, or any hospital. So, in any level nurse is working, the nurse should provide this preventive, promotive, curative, and rehabilitative care. In hospital, care of sick children, that is comfort feeding, bathing, safety, etc., are the basic responsibilities of a pediatric nurse. So, while working in a hospital, this is the responsibility of a nurse to provide care to the child, care to the sick children. Care like comfort feeding, bathing, and safety. These are the responsibilities of nurse. Then health assessment, immunization, primary healthcare, and referral are the basic responsibilities at a community level as a quality care provider. When nurse is working at a community level, means working in a primary health center or community health center or any other community level, so at that time, the nurse should do health assessment. That is periodic health assessments she should do. Then immunization as per WHO recommendation. Then to provide primary health care and referral. Referral means that example if a child is ill, severe ill. That can't be treated at primary health center. So see, the child should be referred to the community health center. So that is called referral. That is referred from one level to another higher level. So these all are the responsibilities of pediatric nurse at community level. Then second role of the pediatric nurse is as a health educator. So pediatric nurse plays an important role as a nurse educator by providing the various health education programs related to the nutrition, hygiene, immunization, etc. So it is one of the important role of pediatric nurse, that is health educator. So pediatric nurse should give education and should conduct various education programs. She should give education on various problems, various topics like nutrition, about good hygiene. Then she should give education about immunization, about disease condition, etc. Then gives knowledge about healthy lifestyle, bad habits, behavior modification, etc. She should also give knowledge about the healthy lifestyles that should be followed in by us. Then bad habits, about which are the good habits and bad habits. Then to when needed to change the behavior, so she should give the knowledge about behavior modification, etc. Then third role of nurse is nurse counselor. Problem solving approach and necessary guidance in health hazards of children to minimize or to solve the problem and to help the parents and family members for independent decision making in different type of situation. It is one of the essential role of pediatric nurse. So one important role of pediatric nurse is also nurse counselor. So as a nurse counselor, she should solve the problems that is identified. She should guide the parents and children in taking the decisions. Then she should help the parents and the family members for taking independent decision. Example, if a child is having chronic illness and a surgery is planned, so we should help the parents to take that independent decision in any situation. Then next role is as a social worker. Pediatric nurse can do casework specially for children and try to alleviate social problems related to child health. So many social problems are identified in children, like a child living with single parent, either mother or father, then siblings abuse, parents abuse, alcohol abuse. So these are some of the social problems. Because of this, child suffers. So when a nurse identifies these social problems, she should do case work and try to alleviate that social problem, try to remove that social problem. Nurse can participate in available social services or refer to child and family for necessary social support from the child welfare agencies. Many agencies are organized for child welfare. So nurse can refer this child and the family to get the support from these welfare agencies. Then fifth role is as a team coordinator and collaborator. Pediatric nurse should work together and in combination with other health team members towards the better child health care. So pediatric nurse should not work alone, but she should work together with other health team members. Means other team health members means doctors, physician, pharmacist, dietitian. So she should work along with all these members so she can provide better care to the child. She should act as a mediator molecule between healthcare team members and family members, which help nurse to maintain good IPR with family members. As sometimes parents can't directly communicate with dietitian or doctor, so nurse should act as a mediator. Means she should stay in between and she should do communication between health team members and family members. So this will also help the nurse to maintain good IPR, means interpersonal relationship with family members. The nurse interprets the objectives to healthcare to the family and coordinates nursing services with other services necessary for the child. Cooperation and good communication among team members should be promoted by the nurse. So the nurse should always promote that good communication is done and cooperation is done among team members. Then sixth is role as a manager. The pediatric nurse is the manager of the pediatric care unit in hospital, clinic and community. So pediatric nurse is team manager. She is called as manager when working in pediatric care unit or clinic or in community level. So she should organize care orderly for successful outcome with better prognosis and good health. She gives direction to subordinates to follow the routine work. So as a manager, the nurse should organize the care very orderly, means step by step, so that child get better care and the child health will improve. So she should organize the care in a good way, in an orderly way. She should give direction to subordinates to follow the routine work. Means what are the routine work of the child? So she can also give direction. Means she can make her junior or other staff to do that particular work. And seventh role is as a child care advocate. Child or family advocacy is basic aspect to comprehensive family-centered care. As an advocate, the pediatric nurse can assist a child to obtain best care from the particular unit. So the child needs care from every unit, that is dietitian unit, pharmacist unit, every unit. So as an advocate, as a role as advocate, the nurse has to help this child so that the child gets best care from all the units. Example, if a child is admitted in medical ward, but due to some chronic condition, surgery is planned and he is referred to the surgical ward. So nurse should make sure that the child gets best care from that unit also. Advocacy can range from consulting dietary department for special food to arrange team meeting to discuss plan of care. See, in advocacy, it can range from consulting dietary department, means if specific conditions are diagnosed like hypertension. So in hypertension, we are giving salt restricted diet. So we have to consult the dietary department so that he gets the food as per his condition. Then arrange team meeting to discuss plan of care. If the condition is very severe or chronic, then nurse can also arrange team meetings so that they all healthcare team members can plan his care. Then it role is as a recreationalist. The supportive role of pediatric nurse is important for the child to adjust to crisis imposed by illness or hospitalization. So as a recreationalist, the role of the nurse is as supportive. So she should support the child so the child can adjust with his illness as well as hospitalization. Child never likes to stay in hospital when a child is ill. So pediatric nurse has to help the child to adjust with the illness also and with hospital stay also. Nurse can organize play facilities for recreation and diversion for child's emotional outlet, as the children do not like to stay in hospital. So nurse can organize play facilities, some play activities, so the child mind will be diverted. Then role as a nurse consultant. The pediatric nurse can promote self-care agent for the children who are unable to take care of their own health. So those children who cannot take care of their health, who are having example mental problems or some physically challenge, so they can't take care of their health by own self. So nurse has to promote self-care agent for those children. And the pediatric nurse can act as a consultant to guide the parents and family members for maintenance and promotion of childhood illness. The pediatric nurse can act as a consultant so that she has to guide the parents and family members for maintenance and promotion of childhood illness. Then next role is as a nurse can, then next point is nurse can help the older child to become responsible and help them in developing the base of self-care and self-responsibilities. And next role is as a researcher. Nursing research is an integral part of professional nursing. So this is one of the important integral part in nursing, professional nursing. Pediatric nurse should participate or perform research project related to child care. As a pediatric nurse, the nurse should participate, should take part in various research projects that is related to child care. Clinical and applied research provide a basis for a change in nursing practice and improvement in the health care of child. As a see in researcher role, the nurse should do some research on specific conditions or the problems that are faced in the clinics that is faced by the children. So after research, the nurse will get the proof, will get the evidence that this needs to be changed, this needs to be changed in nursing practice, this needs to bring improvement. So by this research can help in providing good care to the child. Thank you.